Hi, my name is Ashley Curtis, and I'm going to be demonstrating how to do a intramuscular injection for a patient. So I'm just going to show you what I have here to use to show you. Sorry, that's my dishwasher. This is my Injectipad. So this is going to be like the patient's arm or thigh, depends on where you were giving an intramuscular injection. So know those sites. Here's my medication vial. It is not a single dose, so you can use it more than once, which means the first time that you use it, you need to make sure you put the date that you used it and everything like that. I have my physician's order. I have my syringe already filled with my medication and my needle. And so you need to know as a nurse what size needle and gauge needle that you need, like the length and gauge. So for an intramuscular injection, usually it's a 22 to 23 gauge needle for an adult, but they recommend a 20 to a 21 when it is a viscous, which is thick and sticky material, like liquid that is going into the body or coming out. So I have my 22 gauge needle. It is 1 to 1.5 inch length because my patient, it's going to be 1 inch and a half length because my patient's a little thick here. And you need to know that you go in at a 90-degree angle, okay? All right, so I'm going to get my alcohol swab, my prep pad, open, and I've already introduced myself to the patient, perform my hand hygiene. I'm going to walk and I'm going to rub the site from where I'm going to the outside, making sure that it is nice and clean. Dispose of this in the trash can. Don my gloves. And don't lie to the patient because it is going to kind of hurt a little bit. So never ever lie to the patient because then you've lost the one thing that you definitely need your patient to have for you, which is trust. All right, so with a needle, you have to know that you do not recap a used needle. You can recap a non-used needle. So this is a non-used needle, so I'm going to show you how to do that real quick. So moving my patient. So if you take your cap off, your cap's right here, you're going to scoop, you see my needle? There's going to be the wall right here. You have it up against something, you will scoop the needle into the cap. You do not have your hands anywhere near that needle, okay? So you prevent sticking yourself. So I have my needle in there, and this is also a safety guard. So right here, if you can see, so when you're done, you can just pop it and it'll insert the needle. It's like a safety caution, so you don't have to recap, so it'll prevent sticks. But if you do it, it will not come back out. So if you only have these at home to practice with, don't do it, okay? And don't practice on your children or your friends or anything like that. So I can see my medicine. I'm going to show you just what it looks like. Right? Okay, so since this is intramuscularly, we're going to do it at a 90-degree angle. You're going to hold your needle like a dart. First, you're going to take your cap off. Going to put your hands like this. You're going to go. And I usually, if it's my patient, I go, okay, we're on the count of 3. So 1, 2, 3. And you want to do it in a swift darting motion because the slower you go, the worse it'll hurt. So we're going to put the medication in. Give it a second. Perfect. And I have my cotton pad. I'm going to take it out. Put a little bit of pressure on there, and this will go into a sharps container immediately. Don't leave it on a table where somebody can stick themselves, okay? All right, so that is how to do an intramuscular injection. Thank you.